Join us now for Health for Life, brought to you by Hamilton Healthcare System.
Today we're talking with Dr. Nancy Carnevale of Anna Shaw Children's Institute in Dalton. Thank you for joining us, Dr. Carnevale.
Thank you for having me.
Dr. Carnevale is a board-certified child development pediatrician and the medical director of Anna Shaw Children's Institute located at 1201 Burleson Road behind Hamilton Medical Center in Dalton, Georgia. She specializes in attention disorders, autism spectrum disorders, behavioral and development challenges, and more. Dr. Carnevale graduated from Assumption College in Worcester, Massachusetts, attended medical school at Brown University in Rhode Island, and completed her residency in pediatrics at the University of Connecticut. She also completed her fellowship at Brown University and is board certified in neurodevelopmental disabilities. We've got a very important topic to discuss today, and one that can be both common and frustrating, which is emotional meltdowns in children. Let's start by addressing a common question. What is the difference between tantrums and meltdowns?
So that's a question I hear often. While neither actually has a strict medical definition, what's evident in both of those cases that children struggle to regulate their emotions.
So, tantrums are often associated with the terrible twos. Could you kind of explain what's happening when they're in this developmental phase?
Sure. During the terrible twos, children are experiencing this kind of surge in emotions before they can actually express themselves in a socially kind of acceptable way. So these emotional outbursts can manifest as I'm stomping my feet or screaming or maybe throwing themselves on the floor. But it's really important to recognize that this is their way of communicating their feelings. Typically, tantrums begin around the age of 1, and they start to go away when kids can actually express themselves in just better ways. Now, older children with speech delays may prolong this phase because, again, they can't express themselves verbally. And then when their language skills improve, maybe around 3 or 4, it gets better. So it's important for parents to understand that these children, also have similar challenges in expressing themselves. There's also sometimes psychological trauma can lead to some of these things. Even if a child doesn't suffer direct physical harm, things like witnessing a firearm accident or any other trauma in your life can cause psychological trauma, and children may experience anxiety, fear, and other emotional disturbances as a result of those kind of incidents.
What are some of the key strategies that parents could use when dealing with young children who have tantrums?
So when managing young children with tantrums, the key is staying calm. That's really paramount. You want to really try to ignore the child's behavior rather than reacting with your own emotions. It's also essential not to have any form of physical discipline at that time.
Could you elaborate on what characterizes a meltdown and the common triggers with that?
Certainly. So a meltdown is kind of what we refer to as the emotional dysregulation that now goes past that terrible 2 stage. So when a child loses control to the extent that it only stops when they kind of just wear themselves out, or maybe the parent can get them to calm down. And those are kind of things like anger, for example, is probably one of the leading causes, and that's often typically triggered by just not getting what they want. They may be overwhelmed by frustration and this sense of injustice, like why can't I have it? And it's often due to this not understanding the why behind a decision. It can be partly developmental, as they're just still learning kind of that bigger picture as to why they can't have something. Another thing to know is that anxiety can also be a significant trigger.
You did mention that oftentimes children who experience these emotional outbursts lack certain skills. Could you tell us more about that?
Absolutely. So children who have meltdowns often struggle with impulse control, so they can't control their impulses. Problem solving, again, looking at that bigger picture and trying to figure out how to solve a problem. Communication, delaying gratification, putting something off and having gratification later on. Understanding the expectations, and just overall self-soothing. Additionally, there are conditions like the early stages of ADHD or anxiety or learning issues or maybe depression and or sensory processing issues that can contribute to meltdowns.
So I've heard you mention stages in dealing with these emotional explosions. Could you walk us through these stages, especially, how it could start building up?
So understanding the stages is crucial. So there's what they call the build-up phase, which is they're starting to escalate. Then there's this total rage rage stage, and then 3 is this what we call de-escalation, when they're starting to come down. So recognizing when a child is about to experience anger is challenging, but it can be done. And if they can catch it there before it gets into that full-blown anger, they can try to intervene. Now, once you reach that tantrum stage of total rage, a lot of times talking just doesn't do any good at that point. So it's best to discuss consequences, causes, and talk to them later on after when they're calmer.
What could parents do during the build-up phase to prevent, that chance of a meltdown happening?
So during the build-up phase for a young child, probably the best thing is just a lot of distraction and redirection. It's about turning their attention to something else, like maybe a TV show or a toy, or maybe getting them involved in a fun activity. So that's, trying to distract them from that strong emotion. You can also encourage them to express their emotions using words. For example, saying things like, "I understand that you're angry. You must be so disappointed." And that will encourage them to use words instead of having meltdowns in the future.
I've heard the term mindful parenting. Does it play a role in preventing meltdowns?
Absolutely. So mindful parenting involves just really being aware of your child's needs and trying to anticipate them and meet those needs before they become overwhelming. It's about recognizing their cues and responding appropriately. For example, a simple one is be aware that children may get hungry. Their sugar's dropping. That's going to make them that hangry stage. Keep snacks with you. If they start to get irritable, give them a snack. Anticipate how they're going to react to new situations when they get scared or large crowds. And all those things can help to prevent these meltdowns.
It seems like creating a routine and setting limits. How crucial are those factors in preventing meltdowns?
They are incredibly important. A predictable routine, consistent limits actually help children feel more secure and they reduce anxiety. Additionally, offering choices to a child, depending on the child, can provide them with a sense of control over things. But not all children respond well to choices.
You briefly mentioned sensory processing issues as a trigger. Could you kind of talk about that a bit more?
So sensory processing issues involve how our nervous system receives and interprets information from all of our senses, like touch and taste and smell, and sight, and especially sound. And children can be easily overwhelmed by things like loud noises and bright lights and certain textures. So if you can understand these triggers, you can help minimize them and help them develop coping strategies.
For more information about Anna Shaw Children's Institute, call 706-226-8900 or visit hamiltonhealth.com/children. For an appointment at the Institute, please ask your child's pediatrician for a referral.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.